1. The return of the plague, understanding pneumonic plague in modern times. 2. Arizona plague death, first fatal case since 2007 explained. 3. Pneumonic plague death in Arizona, symptoms, prevention, and latest health alert 2025. 1. The return of the plague, understanding pneumonic plague in modern times. Imagine a grim specter from the past re-emerging in our modern times, a deadly disease once thought consigned to history. The recent death of a person in northern Arizona due to pneumonic plague serves as a stark reminder that the Black Death, far from being eradicated, still lurks in certain corners of the world, including right here in the United States. Local health officials in Coconino County, which encompasses the city of Flagstaff, confirmed this tragic case late last week, marking the first such fatality in the U.S. since 2021. Pneumonic plague, a severe lung infection caused by the bacterium Yersinia pestis, is the rarest form of the disease in the U.S. According to the Centers for Disease Control and Prevention, only about 7 human cases are reported annually on average. Despite its rarity, the occurrence of plague remains a concern, particularly in the western states of the U.S., where it has been endemic among rodent populations for over a century. Why? Pestis made its way to the U.S. around the turn of the 20th century, primarily through port cities, and has since established itself in the rodent communities of states like New Mexico, Arizona, Colorado, California, Oregon, and Nevada. While the risk is real, experts emphasize that it is crucial to keep it in perspective. As David Wagner, executive director of the Pathogen and Microbiome Institute at Northern Arizona University, puts it, it's more important to wear a seatbelt while shopping than to worry about plague in the western U.S. To understand how plague persists, we need to delve into its life cycle. Transmitted primarily through the bites of infected fleas that feed on infected rodents, why? Pestis has been circulating between these animals for thousands of years. Humans can contract the disease if bitten by an infected flea, although this is uncommon. Most human cases result from environmental exposure, such as coming into contact with infected rodents or their fleas. The disease manifests differently based on how it enters the body. Bubonic plague, the most common form, occurs when the bacteria infect the lymph nodes, causing swelling known as buboes. However, if left untreated, the bacteria can spread to the lungs, resulting in pneumonic plague, which is highly contagious and can be transmitted from person to person through coughing. This form of the disease is particularly dangerous, with a high mortality rate if not promptly treated. Pets, especially those that roam freely, can also be exposed to plague through contact with infected fleas. While dogs generally show resistance to the disease and can develop immunity, cats are more vulnerable and can progress to pneumonic plague. This highlights the importance of protecting pets and maintaining good hygiene practices. Despite its historical significance, plague is now treatable with various antibiotics if diagnosed early. However, the rarity of the disease means that many healthcare providers may lack experience in recognizing and treating it. Rapid diagnostic tests are essential to ensure timely intervention. The question of how plague has managed to persist for so long remains a mystery. Researchers, including Wagner and his team, are studying the role of different rodent species in maintaining the disease. By collecting and analyzing plague-infected fleas, they hope to uncover the secrets of plague's enduring presence in the U.S. In conclusion, while the resurgence of pneumonic plague in Arizona is alarming, it is important to remember that the risk remains low for most people. By staying informed and taking necessary precautions, we can continue to manage this ancient disease effectively. What do you think? Do you believe that the threat of plague has been adequately communicated to the public, or do you feel that more needs to be done to raise awareness? 2. Arizona plague death, first fatal case since 2007 explained. ***, a tragic reminder of a historical threat, plague claims life in Arizona. ***. In a shocking development, health officials have reported the death of a resident in northern Arizona due to pneumonic plague, marking the first such fatality since 2007. This incident, which occurred in Coconino County, home to the city of Flagstaff, serves as a stark reminder of a disease that, while rare today, still poses a threat to human health. Plague, a bacterial infection that has historically wreaked havoc on populations, is not commonly seen in modern times. On average, the United States sees only about 7 cases each year, predominantly in the western regions. The identity of the victim has not been disclosed, and local officials have expressed their condolences, stating, "Our hearts go out to the family and friends of the deceased. We are keeping them in our thoughts during this difficult time." Out of respect for the family, no additional information about the death will be released. Understanding the plague, a historical context. The term plague often evokes images of the infamous Black Death, which devastated Europe in the 14th century, claiming the lives of tens of millions. Between 1346 and 1353, it is estimated that this catastrophic event wiped out up to 60% of the population across Europe, the Middle East, and Africa. Fortunately, in contemporary times, the plague is treatable with antibiotics, a significant advancement from the past. Among the various forms of plague, the bubonic plague is the most prevalent, typically transmitted among rodents such as prairie dogs and rats. However, there are two other forms, septicemic plague, which spreads throughout the body, and pneumonic plague, which infects the lungs and is the most lethal and easily transmissible variant. Transmission and precautions. The bacteria responsible for the plague can be spread through bites from infected fleas, which can transfer the disease between rodents, pets, and humans. Additionally, individuals can contract the plague by coming into contact with infected bodily fluids. Health experts emphasize the importance of caution when handling sick or deceased animals to prevent potential infection. Most cases of plague are reported in rural areas of northern New Mexico, northern Arizona, southern Colorado, California, southern Oregon, and far western Nevada, according to the Centers for Disease Control and Prevention, CDC. From 1970 to 2020, the CDC documented 496 cases of plague, with more than half occurring in New Mexico alone. Interestingly, a human case was reported in southern Colorado last July, following the death of a New Mexico resident from the plague earlier that same year. A call for awareness and discussion. This recent death serves as a crucial reminder of the ongoing presence of diseases that many may consider relics of the past. But here's where it gets controversial: should we be more vigilant about such diseases, or do we risk overreacting to a rare occurrence? What are your thoughts on the balance between awareness and fear? Join the conversation in the comments below. 3. Pneumonic plague death in Arizona, symptoms, prevention, and latest health alert 2025. Imagine living in a world where ancient diseases, once thought to be relics of the past, still linger and occasionally claim lives. That's exactly what happened recently in Coconino County, Arizona, a place known for its stunning landscapes and proximity to the Grand Canyon. A resident tragically succumbed to pneumonic plague, marking the first death from this rare but deadly disease in the county since 2007. While health officials have confirmed the fatality, they stress that it is unrelated to a recent mysterious die-off of prairie dogs nearby, which may also be linked to plague. Yet, the timing has left many wondering, is there more to this story? The announcement came on July 11, when health authorities in Coconino County revealed the grim news. Pneumonic plague, a severe lung infection caused by the bacterium Yersinia pestis, is exceptionally uncommon in humans today. In fact, only about 7 cases are reported annually across the entire United States. To put things into perspective, think of how rare it is to win the lottery. This illness is even less common. However, unlike bubonic plague, infamous for wiping out millions during medieval times, pneumonic plague spreads differently. It can travel through airborne droplets, making it potentially more dangerous if not contained quickly. Now, here's where it gets interesting, and perhaps unsettling. Both bubonic and pneumonic plagues stem from the same bacterial culprit, Yersinia pestis. But their modes of transmission differ significantly. Bubonic plague typically enters the body via flea bites or direct contact with contaminated materials, targeting the lymph nodes and causing swelling. On the other hand, pneumonic plague attacks the respiratory system, leading to pneumonia-like symptoms such as coughing, difficulty breathing, and chest pain. And while both forms are serious, pneumonic plague is considered far more contagious because it can spread simply through respiratory droplets. In this tragic case, details about the individual who passed away remain scarce. The person's age, name, and gender have not been disclosed, likely to protect privacy and prevent panic. What we do know is that they sought emergency care at Flagstaff Medical Center but unfortunately did not survive the day. Northern Arizona Healthcare released a statement explaining that despite appropriate initial management and attempts to provide life-saving resuscitation, the patient could not recover. This loss serves as a stark reminder of how swiftly this disease can progress. This incident marks the first recorded pneumonic plague death in Coconino County in nearly 2 decades. Yet, it's worth noting that Arizona has seen human plague cases before, 7 since 2006, to be exact. One particularly notable death occurred in 2007 after someone came into contact with a dead animal infected with plague. Such examples underscore the importance of understanding how zoonotic diseases, those transmitted between animals and humans, operate. Nationally, the Centers for Disease Control and Prevention, CDC, reports an average of just 7 human plague cases per year. Since the year 2000, only 15 plague-related deaths have been documented across the country over a span of 23 years. Most cases occur in rural areas of western states like Arizona, Colorado, and New Mexico. These regions often serve as natural habitats for rodents, which harbor the bacteria without showing signs of illness themselves. Humans usually contract the disease through flea bites, though exposure to sick pets, especially cats, can also pose risks. And this is the part most people miss: plague isn't confined to history books, it continues to circulate quietly among wildlife populations. For instance, right now, Coconino County officials are investigating a sudden die-off of prairie dogs northeast of Flagstaff. Initial suspicions point to plague as the cause, although they've clarified that this event appears unconnected to the human fatality. Still, the coincidence raises eyebrows and questions. To help residents stay safe, local health departments issued guidelines aimed at reducing the risk of infection. They recommend avoiding contact with wild animals, refraining from touching sick or deceased creatures, steering clear of rodent burrows while camping, and skipping the temptation to sleep directly on the ground. Practical tips include using insect repellent and tucking pant legs into socks to minimize skin exposure. Simple steps, yes, but ones that could save lives. Health experts emphasize that the likelihood of human-to-human transmission of pneumonic plague remains extremely low. In fact, the last documented case of person-to-person spread in the U.S. dates back to Los Angeles in 1924, according to data from the National Institutes of Health, NIH. Nevertheless, the symptoms of plague, fever, chills, headache, weakness, muscle pain, and swollen lymph nodes, known as buboes, are unmistakable and demand immediate medical attention. Symptoms generally appear within 8 days of exposure, giving individuals a narrow window to seek help. But here's the twist: timing matters. The convergence of a human plague death and a prairie dog die-off in the same geographic area naturally sparks concern. After all, plague is just one of several diseases endemic to the southwestern U.S., alongside West Nile virus, hantavirus, and rabies. Trish Lees, communications manager for Coconino County, told the Arizona Republic that the exact number of prairie dogs affected remains unknown. Could these events signal a larger ecological issue? Or are they merely isolated incidents? As we reflect on this sobering situation, consider this: how prepared are we, as a society, to handle rare yet deadly diseases lurking in our midst? Do you believe enough is being done to educate the public about zoonotic threats? Share your thoughts in the comments below, we'd love to hear from you.